Hi, my name is Dr. Jeremy Heidt with Pinnacle Chiropractic Rehab in West Fargo, and today I wanted to go over a bit of our exam. We often get patients in that are dealing with back pain, neck pain, shoulder pain, knee pain, and one of the things that I try to bring up is why are we getting that in the first place? And if we can find the root cause of that issue and treat that, we're obviously going to end up in a better place, not only in the short term, but the long term. And one thing that I really like to do, and we get out a lot of answers from, is a functional exam. It's known as the functional movement exam. So I was just going to go over that a little bit today, kind of introduce that. It consists of some squats, lunges, but when we look at this, we actually get patients moving. And if they're squatting down, but they're unable to do it because of knee pain or hip pain, then we can definitely find that out and we can address that. So one of the first things, and these are some things that you can try at home to see if you can do, and if you're not able to do, obviously we can look at it further in the clinic. But the first one is a squat, overhead squat. We want to go overhead with the bar, and then we're going to be squatting down as far as we can go. Oftentimes, if patients are dealing with some sort of pain, they're not able to do that, or they're squatting incorrectly, which that'll come out in that exam. One other thing that we're looking at is a step up. So we want to be able to step up and control that. Sometimes in older patients, they're starting to lose their balance and not able to do that, but that is definitely something we should be able to do. A lunge, taking this bar behind our back and stepping out. That motion, we want to see that nice and controlled. We want to see patients able to do that. It goes from 2 legs in the squat to 1 leg in the lunge. So that basically brings some things out with patients. Another thing that we're looking at is shoulder mobility. So we compare that side to side, and oftentimes patients have decreased range of motion on one side, and that shoulder, if it's not moving correctly, that can cause some pulling up in the neck and cause some issues. We also look at overhead range of motion. Are patients able to get their shoulders up above their head? Sometimes we see where one side's able to and then the other side just is restricted right there, causing some issues. We also get into some core exercises, range of motion stuff. One of the exercises that we should be able to do is go back into flexion really well, extension. We should also be able to come up and do a push-up right there, plank, and side plank right there. And then one other one is rotation. So those exercises right there test flexibility and extension and flexion. It also tests our core strength and our rotational strength. And that exam right there, the functional movement exam, gives us a really good idea. So now we can go work on patients and use the adjustments, use soft tissue work, use stretching and strengthening exercises at home to truly get our patients and get ourselves better in a functional level, get ahead of that pain and get more to that root cause. All right, if you're dealing with any issues, if you have any questions, we'd be happy to help. You can always book an appointment online. Otherwise, have a good rest of your day.